Remember the stages of grief? They can also apply to you and not just your patient or their family. Remember, the stages of grief are not linear. You may feel several of these emotions all at one time or in random orders. As a medical professional, you may experience loss of life more often than others. The first few times that you encounter death, it can be overwhelming. CNAs often work closely with patients and develop relationships with them and their families. When your patient dies, it can shake you. A week later, you may have a new patient in their room. Somehow, you must go on working. Let's consider some ways that you can take care of yourself. The death of someone can impact our well-being in many ways. In particular, it can impact the physical, emotional, and social elements of well-being. Let's take a closer look at how each of these elements can affect your well-being. CNAs who experienced greater distress from grief after their clients died also reported lower physical well-being. Some physical symptoms may include tightness in the stomach, body aches and pain, digestive issues, sleep problems, lower immune system, and fatigue. Taking care of your body is one area you may have the most control. To the extent possible, try to maintain your normal activities. Getting back to your normal work routine may help you adjust faster. The body loves routine. Stay active. You probably move a lot in your job already, but physical activity can also make you feel good. Try to get bursts of exercise throughout the day. Take the stairs if your body allows it. Walk on your break to clear your mind. It might make you feel better. Diet has a huge impact on mental health, so try not to skip meals. If your appetite is low, which is normal for grief, try to have nutrient-dense, smaller meals with plenty of fruits, vegetables, lean proteins, and healthy fats. Rest is essential, but sleep can also be disturbed from distress. Try to work on relaxation techniques on your breaks. Deep breathing is always available and easy to practice. Try stretching before bed. Look into practices like progressive relaxation if you still have trouble. Consider your social support system to cope with your grief. You can start by acknowledging that your own grief is personal and may differ from others. That's okay. Don't hesitate to talk with your supervisor, peers, or even a professional about your grief. Talk to your supervisor about the grief counseling options available through your employer. Your supervisor and peers may also have experience with similar losses and can make some suggestions on how they cope. While death is difficult, consider the good that comes from each experience. Many patients and families express gratitude and love when a loved one passes away. Reflect on your role in making the experience calming and meaningful for the family, and find joy in your professionalism. Grief can come on suddenly and overwhelm your emotions. If that happens, consider taking a break to clear your head, remove yourself from the triggering situation, and take several deep breaths. Communicate with your peers if you feel overwhelmed. It may go without saying that death can impact your emotional well-being. You may feel a number of emotions all at one time. It's completely normal. Self-care activities vary from person to person, but may include spending time with friends and family, exercising, reading a book, or spending time in nature. Whatever your method of self-care, take some time to engage in safe and healthy self-care activities to keep yourself energized. Prioritize your own emotional needs. The airline's instructions, "Please put your mask on before helping others," comes to mind when discussing prioritizing emotional needs. It is important to understand your own emotions before helping others. Prioritizing your emotional needs may mean acknowledging sadness, grief, and anger. Acknowledging these feelings is the first step in moving forward. Sometimes you need to take a break from emotionally charged situations. If you are overwhelmed with emotions, or in a situation you feel may trigger your emotions, find a professional way to step out for several minutes and regain your composure. You should walk around outside the building or sit in a quiet room. Be honest with yourself and with others about how you are feeling. It may take some time to feel normal again. Do the best you can from moment to moment and communicate if you are struggling. Carefully consider what might bring you closure. Talking about death and grief can be very difficult for some people. we often are not given the tools to discuss how we feel. However, death is a normal process, especially in the healthcare field. Your colleagues and supervisors are likely to understand, and many of them will be able to talk to you about their coping mechanisms. Chat with other staff to see how they manage death in their jobs and tell them how you feel. Reach out to your social support system, such as your family and friends, to provide support. Your own family and friends are also good support systems in a counselor. You may feel more comfortable talking to a mental health professional who specializes in grief counseling. You can check with your insurance about counseling coverage. If you had a close relationship with the family, you could talk to or write a letter to the patient's family members. Connecting with them about their loss shows compassion and may be helpful for your own closure. However, be cautious about laying any additional burden on the family. Consider attending the funeral. Sometimes attending a funeral or other end-of-life celebration can give you closure. In most circumstances, families appreciate healthcare professionals attending. Of course, that is not always the case, so use your best judgment. Whether you're able to do it at a funeral with others or just by yourself, it's good to try and celebrate or remember the positives of the patient. Say goodbye to them by honoring your memories of them. The death of a patient can impact you socially, emotionally, and physically. So be mindful of your well-being as you help patients through this transition. Your well-being matters during this process. I want to end this talk the way that I began, with acknowledging that death is hard. But death is part of the human experience. It is an incredible privilege for you to be able to help those who are going through the end of life. It is hard, but incredibly important work. There are additional resources in this module for you to turn to for specific needs.